no testing sites in Rains County. The closest facility doing free testing for Rains County is Longview, which is approximately an hour and a half to 2 hours away.
Rains County in East Texas, population 12,500, is one of the smallest in the state.
It's definitely a trip. You'd have to miss work if you lived, to go do that. Your child would have to miss school to take them to do that.
As COVID has moved into rural counties, access to testing has not always followed. That means many of these places don't know who's infected and potentially allowing the virus to spread.
Let's say you have a population of 100 people, right? And you test 10 of them. Out of that 10, 2 come back positive, right? That is a test positivity rate of 2 out of 10 or 20%, which is a really high test positivity rate and indicates insufficient testing. Anything above 10% is a really high test positivity rate.
The higher the percent positivity, the more it suggests that the infection is spreading and that you may not be catching all of the cases.
Based on the most comprehensive national database, we identified over 600 counties that do not have a COVID testing site. According to COVID Act Now, 267 of these counties have positivity rate data available, and more than half have a positivity rate above 10%. On the whole, the counties without testing sites tend to have higher positivity rates than the counties with testing sites. Although the number of cases in Rains County has remained low, the county's positivity rate has climbed above 10% in recent months.
I feel like there would be a lot more if there was more testing.
In Clark County, Missouri, until the end of August, if residents wanted a COVID test, for many that meant traveling out of the county or state.
At the time that I needed tested, we could either go to the county beside us where there's a hospital, or we could go to Quincy, Illinois, where there's a hospital.
Wilson chose Quincy, about an hour from her home in Clark County. She and her cousin both tested positive in late July, becoming the 3rd and 4th cases in the county. She reached out to people she'd been with and told them to get tested.
I honestly can say I don't think one person went and tested that we notified.
3 weeks later, there were dozens of confirmed cases, and the county had a positivity rate of 28%, among the highest in the country at the time. On the same day that Wilson's test came back positive, Winter Schlater started feeling sick.
And I was just dizzy and nauseous, and my head hurt, my throat hurt, my nose was burning, I couldn't taste or smell.
Schlater didn't get tested for COVID because she would have had to drive 30 miles to the closest testing site in Scotland County, Missouri. But the next week, when her 71-year-old diabetic grandfather, who she lives with, started having difficulty breathing, he ended up traveling over an hour to a hospital in Hannibal, Missouri for a test.
He got tested and was COVID positive and ended up staying 2 weeks in the hospital and came home on oxygen. And he's still on oxygen.
While her grandfather was in the hospital, Schlater got a test in Scotland County. It came back positive for COVID. At the end of August, Clark County opened its own testing site. It only offers tests 3 days a week and only for patients who have virus symptoms or known exposure. To improve testing access in rural areas, some states have set up mobile testing sites.
And that kind of works as a stopgap measure.
Rains County has had 3 community testing events.
Those are the only 3 dates that we've had free testing sites in the county, or any testing sites whatsoever within the county. I believe that the COVID-19 pandemic has shown a light on the need for access to health care in rural communities.
Maya Rosenfeld, Newsy, Washington.